In today's morning rounds, controversial new research surrounding the meat in our diets. New guidelines in the journal Annals of Internal Medicine say you do not need to cut back on red or processed meat. The researchers say there's a weak connection between meat and disease, but some U.S. health organizations are pushing back. One even filed a petition with the FTC to, quote, correct false statements regarding consumption of red and processed meat. The American Heart Association, the American Cancer Society, and the American College of Cardiology all reiterated their recommendation to cut red meat consumption. Our Dr. Tara Narula, a cardiologist, is here to break it all down. Tara, good morning.
Good morning.
I'm confused.
You should be confused.
What's going on?
So let's talk about what this was. Okay, this was a private group that basically decided to go back and look at prior nutrition research as it relates to meat consumption. This was not new research. They put it all together, and in fact, they found that, you know what, there is a benefit in terms of decreases in cardiovascular disease, mortality, and cancer if you consume less meat. However, they then went the next step to say that they thought the benefits were small. They thought that this was sort of uncertain, low kind of quality evidence. They looked at people's preferences and says, well, people like to eat meat. It fits in with their culture. It's hard to change. And then they crafted guidelines. Okay, these are not guidelines that came from an official government organization, an official health body. It is from this group of 14 individuals, mostly research scientists, who said that, you know what, since the benefits of really cutting meat are there, but they're small, they're not really outweighed by the difficulty it is for a lot of people given their cultural and quality of life and eating preferences. So go ahead and continue eating as you like to eat.
My head is spinning like The Exorcist. So I'm curious about, what do you and your cardiologist homies say we should do with this new information?
Well, I can tell you there was a lot of outrage in the cardiology community and amongst others who really felt that this message is a public health, it's a disservice.
That's what they called it in a statement.
Yeah. Yes.
And a major disservice to public health.
That's right. So they felt that, you know what, there is an abundant body of evidence when you look back that shows the benefits of reducing red meat consumption, that we know that, you know, processed meat and red meat are considered carcinogens, that they do have effects on the cardiovascular system and diabetes. They felt that the analysis was conducted really improperly, that they left out a lot of data, that they didn't use the best quality methods to analyze it, and that putting people's preferences into a guideline doesn't really make sense. It would be like saying, well, I know you like to smoke and it's tough smoking, so you know what, go ahead and keep smoking.
This isn't the first time we've had a study seem to contradict other studies, so give us a little mini trip to medical school here. How do we tell which studies we should listen to and which studies to ignore?
Well, you need to understand that nutrition science is hard to do. It's not like the best type of study, which is called a randomized control trial, where we take somebody and put them on a drug and somebody else and we don't put them on the drug and then we follow them over time. You can't really do that easily with diets. You can't say, you, Tony, eat red meat for 10 years, Anthony, don't eat red meat, and then let's follow you after. So what we do is something called an observational study, where we basically give people questionnaires to fill out over time, and then we follow them, and then we see what happens. And then you make inferences. You say, well, you reported that you didn't really eat that much meat, and then you didn't develop cancer. So there's a lot of confounding factors there.
Okay, quickly, what do we do?
That's right.
So at this point in time, bottom line, you know, all of the societies, all of the, you know, health officials and are basically saying, do not change what you're doing right now. You should continue to limit red and processed meat.
Okay.
Yes.
You don't have to give it up, but limit it.
Yes.
All right. Thank you, Dr. Tara.
Thank you.
Sorting it out.